Female infertility refers to the inability of a woman to conceive after 1 year of regular, unprotected sexual intercourse. It is a multifactorial condition that may involve issues with the reproductive system, including ovulation disorders, fallopian tube damage, endometriosis, uterine problems, and age-related factors. The primary criterion for diagnosing female infertility is the inability to conceive after 12 months of regular, unprotected intercourse for women under 35, or 6 months for women 35 and older. Early evaluation may be warranted based on medical history and risk factors, such as irregular menstrual cycles, known reproductive tract issues, history of pelvic infections, or if the male partner has known fertility issues. Investigations required include ovulation testing, hysterosalpingography, HSG, ovarian reserve testing, laparoscopy, hormone testing, and imaging tests such as ultrasound and sonohysterography. Fertility treatments, including ovulation stimulation, in vitro fertilization, IVF, and intrauterine insemination, IUI, can come with various side effects and costs, which can be significant. Here's an overview of potential side effects and cost considerations for each procedure. Ovulation stimulation side effects. Medications used for ovulation stimulation, such as clomiphene citrate and gonadotropins, can have side effects. Common side effects include mood swings, headaches, hot flashes, abdominal discomfort, and in rare cases, a condition known as ovarian hyperstimulation syndrome, OHSS, which can be serious. Cost. The cost of ovulation stimulation can vary widely depending on the medication used, monitoring requirements, and geographical location. Oral medications like clomiphene citrate are generally less expensive than injectable gonadotropins. However, the cost can still be significant, especially when including the expenses for monitoring and follow-up consultations. In vitro fertilization, IVF, side effects. IVF can have more pronounced side effects due to the higher doses of fertility drugs used to stimulate the ovaries. These can include the risks of OHSS, potential emotional stress, and very rarely, complications from the egg retrieval procedure. There's also a slightly increased risk of multiple pregnancies, which can lead to complications for both the mother and the babies. Cost. IVF is generally the most expensive fertility treatment option. The cost can include medications for ovarian stimulation, monitoring, egg retrieval procedure, laboratory fertilization, and embryo transfer. Prices vary significantly by country and even within regions of a country, but IVF can cost several thousand to tens of thousands of dollars per cycle. Additional costs may include genetic testing of embryos and storage fees for frozen embryos. Intrauterine insemination, IUI, side effects. IUI is associated with fewer side effects compared to IVF, largely because it often involves less medication. However, if fertility drugs are used to stimulate ovulation, the side effects can be similar to those of ovulation stimulation. There's also a small risk of infection following the procedure. Cost. IUI is less expensive than IVF but still carries costs related to the sperm preparation and the procedure itself, in addition to any costs for medications to stimulate ovulation and monitoring. The costs can range from a few hundred to several $1,000s per cycle, varying widely by location and specific treatment details. Overall considerations: the cost and side effects of fertility treatments can vary significantly, and insurance coverage for these procedures also varies widely. Some insurance plans cover part or all of the cost of diagnosis and treatment, while others offer limited or no coverage. It's crucial for individuals and couples considering fertility treatments to discuss the potential side effects and costs with their healthcare provider. Many fertility clinics also offer financial counseling to help patients navigate the costs and payment options for treatment. Imagine a natural method that offers an alternative to traditional fertility treatments such as ovulation stimulation, intrauterine insemination, IUI, and in vitro fertilization, IVF. This innovative method not only saves time but also reduces the risk of side effects, potentially offering a higher success rate. It involves a simple regimen of orally administered drops aimed at safeguarding your health against adverse effects, lowering costs, and simplifying the treatment process. Are you interested in learning more about this option? Many experts in the field of infertility may not be aware that certain individuals, particularly those with specific constitutional types, can achieve fertility through the use of tailored constitutional medicine, aligned with natural principles. Therefore, I strongly advocate for healthcare professionals specializing in female infertility to consider this alternative. Before resorting to conventional treatments, it is wise to explore the constitutional approach to infertility for a period of 3 to 6 months without any initial diagnostic tests. This approach does not require preliminary investigations, and if fertility is not achieved within this timeframe, couples can then seek further evaluation. This presents an exceptionally convenient option. From my experience, nearly all of my patients have conceived using this method, with the exception of one case involving a partner with a significantly low sperm count and over 95% sperm immotility. I believe that at least 25 to 50% of women, without major anomalies in the genital tract, will conceive using this approach. If there is no success after 6 months, it's advisable to conduct investigations to identify any underlying issues before considering conventional fertility treatments like ovulation stimulation, IUI, and IVF. Primary female sterility is observed in highest order in Natrum muriaticum constitutions. Other constitutions prone to female sterility are indicated in highest order in red, followed by green and white. Infertility may be associated with various factors including copious or profuse menstrual flow occurring either early or late, menstrual cycles that are either too early or too late, but with normal flow, menstrual flow that is too scanty. Suppressed menstruation leading to infertility, infertility resulting from self-reproach, sterility associated with excessive and lack of sexual desire, non-retention of semen or excessive vaginal mucus discharge after intercourse, leading to sterility, association with breast atrophy and ovarian atony as a cause of sterility. In many instances classified as chemical pregnancies, contemporary literature reveals that the precise causes remain unidentified. It is strongly suggested that constitutional factors could play a pivotal role, an aspect frequently neglected by traditional medical practitioners due to their unfamiliarity with constitutional analysis. Consequently, these professionals might erroneously label such cases as chemical pregnancies, relying on speculative hypotheses instead of definitive causes. The most commonly identified potential cause involves embryos exhibiting genetic abnormalities, especially abnormal chromosomes. This condition may be particularly relevant to women with specific constitutional types, as demonstrated in 2 cases linked to the Natrum muriaticum constitution I encountered. Initially diagnosed as chemical pregnancies leading to miscarriages, these cases saw successful subsequent pregnancies after the administration of the appropriate constitutional medicine. The origins of chemical pregnancies are also believed to include other factors, such as uterine abnormalities and hormonal imbalances. Issues like fibroids or inherent abnormalities, for example a uterine septum, could disrupt the embryo's implantation and development process. Additionally, evidence suggests that hormonal imbalances and metabolic disorders, including thyroid diseases, diabetes, insulin resistance, and polycystic ovary syndrome (POS), might increase the likelihood of chemical pregnancies or miscarriages. Further, conditions such as autoimmune or blood clotting disorders, exemplified by antiphospholipid antibody syndrome, have been associated with a heightened risk of miscarriage or chemical pregnancy. These disorders produce specific antibodies that can lead to small blood clots, negatively impacting the early stages of pregnancy, although this is still a hypothesis. Obesity, diabetes, and high blood pressure have also been linked to an increased risk of chemical pregnancy. I assert that a comprehensive constitutional analysis can accurately identify the underlying causes of the majority of chemical pregnancies. Moreover, the application of the corresponding constitutional medicine can significantly reduce the recurrence of these pregnancies, highlighting the potential for a more targeted and effective treatment approach. I recognize that differentiating between biochemical pregnancies and other types of non-viable pregnancies is not my main focus, provided the pregnancy does not culminate in a successful outcome. Whether it involves a biochemical pregnancy, typically identified before the 5th week, or any other form of pregnancy loss occurring after the 5th week under various criteria, the outcome is invariably a pregnancy that does not progress. Instead, my attention gravitates toward identifying the principal treatable causes of fertility challenges. Specifically, certain constitutional types specific to female infertility, as delineated in homeopathic medicine, including natrum muriaticum, aurum metallicum, natrum carbonicum, and sepia, among others, are more susceptible to facing fertility issues or experiencing miscarriages, even after the successful implantation of a zygote. Examples of constitutions predisposed to miscarriages, but not limited to these, encompass caulophyllum, Kali carbonicum, and sepia. This exploration is integral to a broader discussion on the fundamental causes of sterility and miscarriages, a topic I plan to examine in greater depth in the second segment of my presentation. Natrum muriaticum, commonly known as salt, is the most prevalent constitution linked to female infertility, marked by several distinctive features. It's crucial to recognize that not everyone with a natrum muriaticum constitution will display all these features. About 70% of individuals with this constitution share these characteristics, though exceptions exist. This overview of the natrum muriaticum constitution is provided for educational purposes. For a comprehensive analysis, it is advisable to consult the constitutional expert. These individuals often take things badly, prefer to be alone, and might exhibit black discoloration around their nails. They are offended easily, prone to brooding, and suffer from constipation, which initially presents as hard but may later become soft. Their craving for salt and sweets is notable, though some may desire less salt. They frequently dream about robbers and have continuation dreams. During menstruation and generally, they may experience chills, especially in the hands and feet. A distinctive physical symptom is the presence of cracks in the center of the lower lip. Regarding the genital organs, the characteristics include sterility, with menstruation occurring too early or being excessively profuse. Before menstruation, emotional symptoms such as crying and irritability are common, while sadness is often felt during menstruation. An aversion to sexual intercourse, which can be painful due to vaginal dryness, is noted. Vaginal discharge is typically plentiful, transparent, whitish, and thick. Parenthood is a deeply cherished goal for many couples, symbolizing their desire to nurture, guide, and cherish a new generation. This aspiration, embedded in the essence of human existence, motivates countless individuals and couples to embark on diverse paths to achieve it. While the path to parenthood is direct for some, it presents considerable hurdles for others, including fertility challenges, the complexities of adoption, and the exploration of surrogacy and assisted reproductive technologies. The pursuit of parenthood reflects a profound longing to establish family connections and to contribute to the development of future generations. It transcends the mere biological act of procreation, encompassing the emotional and spiritual joy derived from child-rearing. This endeavor may test a couple's endurance, patience, and resources, yet it equally showcases their commitment and eagerness to explore all avenues to realize their parenting dreams. However, both aspiring parents and professionals in the field of infertility often overlook a critical and straightforward path: the constitutional approach to infertility. This method, simple and cost-effective, requiring no lab tests or invasive procedures, can yield positive outcomes for approximately 25 to 50% of women facing infertility issues. In the second part of this presentation, I will unveil how this approach has empowered women to achieve motherhood through nature's path. To gain a deeper understanding of this method, I strongly encourage you to subscribe to my channel, Try Incurable.
I am Dr. Sudhakar Reddy Tirupthi, specializing as a pediatrician and holistic practitioner with a focus on spiritual medicine named homeopathy. I extend a warm invitation for you to explore and subscribe to my channel, Try Incurable. Here, you'll uncover a treasure trove of unique and insightful health-related content that transcends traditional approaches. My channel is a source of invaluable information with the potential to significantly impact your life positively. Should you be inclined towards a holistic view of health, I urge you to subscribe to Try Incurable and share this resource with your network. I deeply value your time and interest in my approach to holistic health, and I sincerely thank you for it.